Now, reading on your bio, it says that you carry out research into evidence-based medicine. What does that mean? Isn't the practice of medicine based on evidence?
It's a great question. And I think to some people, evidence-based medicine sounds redundant because if you're not basing it on evidence, what were you doing?
Witchcraft.
Voodoo. Really?
Right, yeah.
And I think the truth is, in the history of Western medicine, we have to acknowledge that for thousands of years, the type of medicine people practice was largely driven by theories of how the body worked, maybe about bile or black colic or different fluids in the body, blood and bile. They were based on what your boss taught you. It was a sort of an apprenticeship model. And people learned what was the way to practice medicine based on the eminence of their teacher. It's almost an era of eminence-based medicine.
Mm-hmm.
And it wasn't until, in the 20th century that we started to do more controlled clinical experiments where we really tried to sort out, how well do therapies work versus the alternative versus doing nothing. And the revolution of evidence-based medicine was really in the 1990s, where people realized that a lot of the traditional ways in which we thought about the body, trying to reduce it to the mechanistic parts and reason upward, could sometimes lead you astray. And so we needed to sort of approach medical questions by thinking first and foremost about the patient, their desires, their goals, and then the choices that they face and the evidence that supports those choices. And to some degree, it has been sort of a renaissance in medicine in the last 30 years.